our question that the trial addresses is whether or not uh, drugs to treat osteoporosis, that is, improve bone strength, can reduce the high risk of fractures in patients with Parkinson's disease. The We faced at the beginning the problem that this would require over 3,000, 3,500 patients with Parkinson's disease, which would be the largest trial by an order of magnitude that's ever been conducted in that condition. That the patients have disabilities that make it difficult for them to come into clinical sites, and and they often have other people assisting them at home. So it's especially difficult for them to make visits. So we need 3,500 people who have a condition that makes them not want to come into clinical sites, or to minimize that. That's one. And we had to do a number of things that are typically done only in clinical sites. They're steps in a protocol that can be complicated and almost always done at sites. So to start with, the drug is an intravenous infusion, and it's given over the course of 45 minutes. You have to have a measurement of renal function prior to that, because it's contraindicated in patients who have any degree of renal dysfunction. The drug can cause sores in the mouth called ONJ, osteonecrosis of the jaw. And so an examination has to be done of the mouth to make sure that the patient isn't going to have isn't at risk of that condition. Uh, these patients have difficulty doing the usual online consent where you use DocuSign, and they have to be facile with, you know, their neuromuscular function to be able to hit the little spots where you sign on a DocuSign form. So it needed, the attention, the assistance, and a different approach, just for examples. And it's very important that these patients take vitamin D prior to this infusion. Very important that they complete 2 weeks worth. So we send that out in advance, and we need to be sure that they're compliant. We can't just say, my self-report. So you can see all of these things would typically, oh yes, and we have to confirm the diagnosis of Parkinson's disease by, by a neurologic examination. That's a lot to do. And the very beginning of this, you say, that's it. This is only a site-based trial. Well, because of the necessity of reaching so many and the difficulties, we started off by saying, we're going to do this at home. Now, how do we do it? And many of the elements I've talked to you about were possible only because of research home nursing. I was pleased to learn that PCM Trials has a research pharmacy that can manage this intravenous drug as well as the vitamin D, sending it directly to the people who are going to be at home, the research nurses. That made almost everything possible. Uh, a test of renal function. There's a finger stick blood test that's available, we found, that the nurses could administer to make sure that the quality was right. And so the nursing organization comes in and tests renal function. That's terrific. What about the mouth exam? Well, the nurses are trained to do a very good mouth exam. But if there are any questions about it, they have a cell phone and can take a picture and a video of the mouth, which is then sent to uh, our expert at Duke University to observe, um, maybe help the nurse do a better examination, but to confirm that it's normal with that centralized physician. Uh, the nurses were able to provide to oversee a wet signature for consent, which is essential, for this patient population. And were able to do a pill count for vitamin D, observe that they had taken it, rather than just getting self-report. All of those things made this trial possible. And disconnecting it from the clinical sites means that because of PCM Trials services, we are now recruiting patients in over 40 states. And their PCM Trials is so far providing coverage for over 500 patients so far distributed all over the country. And the good thing is, as we find a person who's eligible, uh, PCM Trials is able to find a nurse. South Dakota, no problem. Iowa, no problem. Sometimes it requires that the nurse go stay overnight in a hotel and then go see the patient. But they're very flexible, adaptable, and I've t- and it's say that that's what's made this big trial the largest ever done in Parkinson's. A feasible thing to design, feasible thing to get funded, and a feasible thing to do.